Mitochondrial DNA as a marker of in vitro fertilization outcome in polycystic ovarian syndrome patients. Submitted by Ghadir Ali Said Bostawisi, Assistant Lecturer of Biochemistry, Faculty of Pharmacy, Egyptian National University. Under supervision of Prof. Dr. Hussein Ali Issawaf, Professor and Head of Biochemistry Department, Faculty of Pharmacy, Egyptian National University. Associate Prof. Iman Hassan Ibrahim Hijab, Associate Professor and Acting Head of Biochemistry Department, Faculty of Pharmacy, Girls, Al-Azhar University. Prof. Dr. Ahmed Hussein Ali Issawaf, Professor of Obstetrics and Gynecology, Faculty of Medicine, Cairo University. Outlines: Polycystic ovary syndrome, mitochondrial DNA, mitochondrial DNA and female infertility, PCOS and mitochondrial DNA copy number, mitochondrial function in the oocyte and early embryo, embryo quality and mitochondrial DNA copy number, and finally, the conclusion. Polycystic ovary syndrome. PCOS is an ovarian disorder characterized by hyperandrogenism, ovulatory dysfunction, and polycystic ovaries. It is the most common reproductive disorder that affects 6 to 10% of all women in reproductive age. Hyperandrogenism can occur via the hypothalamic pituitary axis and increase of LH secretion. Elevation of the release of gonadotropin-releasing hormone and subsequent LH secretion is the most important pathophysiological feature of PCOS. One of the major causes of female infertility is anovulation, and only 7 to 18% of PCOS patients are ovulatory. Although infertile women with PCOS may typically present with increasing oocytes retrieved in IVF cycles, most oocytes have poor quality. IVF is considered third-line treatment for anovulatory PCOS women who fail to conceive despite ovulation induction. Embryo selection is mainly based on morphological criteria. However, good morphology of the embryo doesn't necessarily indicate good functional status. Some of these embryos might be genetically abnormal. Mitochondrial DNA. Mitochondria produce energy in the form of ATP via oxidative phosphorylation. Therefore, the number of mitochondria in a cell is related to the energy requirement of this cell. Mitochondrial DNA comprises 0.1 to 2% of the total DNA in most mammalian cells. There are several unique features of the mitochondrial DNA. Human mitochondrial DNA is a double-stranded circular DNA molecule of 16,569 base pair, weighing 107 daltons, and encodes 13 polypeptides, all of which are core components of complexes 1, 3, 4, and 5 of the respiratory chain. Mitochondrial DNA and female infertility. As with many tissues, the reproductive organs have specific metabolic and energy requirements during development and during adult function. The mature oocyte is the largest cell in the human body and has a correspondingly high mitochondrial content. Numbers of mitochondria and their function are tightly linked to the development of the oocyte. PCOS and mitochondrial copy number. The change in mitochondrial copy number is related to the occurrence and development of PCOS. PCOS women have lower mitochondrial DNA copy numbers than those without PCOS. The mitochondrial DNA copy number of patients with PCOS is negatively correlated with insulin resistant level with circumference and triglyceride levels and positively associated with sex hormone binding globulin levels. The decrease in sex hormone binding globulin level not only increases the biological activity of androgen, but is also closely related to insulin resistant and metabolic syndrome. Mitochondrial DNA plays a fundamental role in the increase of RAS, and decreased mitochondrial DNA content in peripheral leukocytes is associated with the development of type 2 diabetes, which is the latest stage complication of PCOS. Mitochondrial function in the oocyte and early embryo. All of the complex process the oocyte goes through prior to ovulation and fertilization require energy, which is derived mainly from ATP production via oxidative phosphorylation. Severe deficiency of cellular ATP content often leads to cell apoptosis. The mitochondria of maturing oocyte and pre-implantation embryos undergo qualitative structure transformation and changes in cytoplasmic distribution. These structural changes result in highly active oxidative metabolism and ATP production, impacting oocyte quality and embryo development. Embryo quality and mitochondrial DNA copy number. During initial embryo cleavage, the mitochondrial distribution between blastomeres may be unequal. Whenever it occurs, cells receiving less mitochondrial DNA exhibit a reduced bioenergetic capacity and consequently evolve to lysis and death. Granulosa and cumulus cell mitochondrial status directly influence embryonic development, as well as the capacity for the activation, maturation, and fertilization of oocytes. Mitochondrial DNA content in cumulus cells is correlated with the amount detected within the oocyte for each cumulus oocyte complex. There are associations between higher mitochondrial DNA amount in cumulus cells and good quality embryo. Fertilized oocytes have a considerably greater amount of mitochondrial DNA, whereas oocytes from older women or from those who present with ovarian insufficiency express fewer mitochondrial DNA copies prior to fertilization. Conclusion. This review supported the hypothesis that mitochondrial DNA content is linked to embryo quality. Thus, the quantification of mitochondrial DNA copy number during the in vitro fertilization procedure may allow the selection from a given cohort of oocytes those that are more likely to lead to good quality embryos. It would be particularly interesting from an ethical point of view to choose the oocytes with the greatest potential for fertilization, thus limiting the production of supernumerary embryos. Thank you.